Hey there, thanks for joining. Dr. Barry Reed, Mason Spine and Injury Center here in the greater Cincinnati, Ohio area. Today's topic, concussions. Bonk. And that's a misnomer. You don't have to hit your head to get a concussion. Typically we think of football players, you have a massive hit. And of course, those can create concussions. But the brain sits in a bath of fluid inside the skull. And if your skull does that, then your brain can bounce off of one of the interior walls of your skull. And if it gets bruised, for lack of better terms, then those types of concussion symptoms can result. So, I'm going to go through a couple of ideas today with you, things that you can think about if you or your kids or your parents or friends or family members, you suspect a concussion, then you can keep these things in mind. It's a standard questionnaire. It's called the ACE. It's Acute Concussion Evaluation, and you can look it up online. But there's a couple of questions, quite a few actually. If people have any of these symptoms, please make sure you see the right person for evaluation, deep evaluation, a real evaluation. And typically, concussion evaluations are hard to find practitioners to do them well. We do them all the time in this office. We've seen lots and lots of cases where people have had automobile accidents or sports-related injuries, and they'll come in and they say, I just don't feel right, or I'm having headaches now, or I'm having difficulty understanding things. So those all are symptoms of concussion syndrome, as we call it. But this questionnaire has the following ideas to be very careful with if you're having after you have a head hit or something caused your head to move quickly. Headaches, sensitivity to light, sensitivity to noise, nausea, fatigue, numbness or tingling anywhere. Visual problems. Visual problems is if you're looking at something and you're having difficulty understanding what you're looking at. Vomiting. Balance problems. Balance problems, especially after you sit and come back up. Those are prevalent quite often in concussion-based cases. Dizziness. So either balance problems or dizziness. Feeling mentally foggy. Having difficulty concentrating. Having difficulty understanding what you're reading. Having difficulty understanding what you're seeing. Having difficulty understanding what someone is telling you. Any of those are all orange or red flags. Memory problems. Can you remember what day of the week it is and roughly what day of the month it is? And this is a good one. The last pair of shoes that you wore, not the ones that you're wearing now, the last pair of shoes that you wore, do you know where they are? Typically, people that have concussion-based symptoms can't answer some of those questions. Feeling more slowed down, irritability, sadness, feeling more emotional than you did before this incident, having nervousness that is abnormal or higher than normal that you possess, sleep, being drowsy, just being exhausted, being tired all the time, sleeping more than usual or sleeping less than usual, and difficulty falling to sleep. Those are the questions. And if you score a certain number of points, then you qualify for having post-concussion syndrome. So that's the how do we find out. The treatment is a whole nother set of things. Typically in this office, we start with very simple but tried and true methods to help the neuroregenesis happen. The healing can be sped up, believe it or not. And typically that's done with different games on the computer that trigger different parts of your brain to try to re-coordinate themselves. And the visual part of your brain. We give eye exercises. Those exercises trigger the largest part of your brain that does the most computing. And if we can get that to work again, it will help coordinate the rest of your brain, and it will help you overcome these concussion-based problems more quickly. And it works. It really works. I've worked closely with a physical therapist that does nothing but concussion rehab. And I've been through that program myself. So I understand how the best possible therapy for concussion is evaluated and put into practice for those poor people that are having symptoms of concussions. So if you suspect that you may have a concussion or know someone who has had a concussion or you suspect has had one, please let us help you if you want. Again, Dr. Barry Reed, Mason Spine and Injury Center here in the North Cincinnati area. Free consultations. We'll be happy to help you. Give us a call today. Thanks and take care.